Our top focus in this bulletin: as India begins the second phase of its mega COVID-19 vaccination drive, Indian Prime Minister Narendra Modi has taken his first dose of the vaccination. The Prime Minister was given the dose of India's first indigenously developed vaccine against COVID-19, Covaxin, developed by Bharat Biotech. He shared a picture of him getting vaccinated at New Delhi's AIIMS today. He also called the efforts of Indian doctors and scientists remarkable for working in quick time to strengthen the global fight against the pandemic. And he also appealed to those eligible for the vaccine to take the same and make India COVID-19 free. Let's now tell you who will be eligible for vaccination in the second phase. Well, in the first phase, only healthcare and frontline workers were being vaccinated. And now in the second one, India will vaccinate those above the age of 60 years and those above 45 years with underlying comorbidities will also be vaccinated. The second question, of course, is what are the comorbidities outlined by the government? The Indian government has listed out 20 comorbidities that would be covered for vaccination. A few of those are diabetes or hypertension for over 10 years, HIV infection or any other immunological disease, heart failure that resulted in hospitalization over the last 1 year, and also those diagnosed with cancer after the 1st of July last year, or those currently being treated for cancer. Now, for our viewers, we'd like to say that you can find the entire list of all the comorbidities outlined by the Indian government on the Indian Health Ministry's website. So do log on and check out the underlying comorbidities. And if you are eligible, do sign up for the vaccine. Now, the next important question is, how can one register themselves on the family or their family for the same? Well, for that, you need to download the Co-WIN app on your smartphone. The Co-WIN app, that is, which can be used to identify if you are in fact eligible for the vaccine, or alternatively visit the Co-WIN website. And once you're on the portal, the person will need to submit their government identification number, and once verified, the vaccination centres in your vicinity will be displayed. You can then select your preferred centre and time slot according to convenience. There is, of course, an alternative as well. A person can simply walk into a vaccination centre without registration, but will only get the jab if the day's quota is over. Now, the people who wish to get vaccinated need to present an age proof. The Government of India has listed out 7 documents that the beneficiary can use for online registration, and those documents are your Aadhaar card, the electoral photo identity card or your voter ID, your passport, driving licence, PAN card, the NPR smart card or your pension document with a picture attached. So what about the price of the vaccine, which of course is an important concern? While the vaccine will be administered for free at all government centres, private hospitals have capped the price at around $3.4 per dose or 250 Indian rupees. Now, for more on this story, we are being joined by our principal diplomatic correspondent, Siddhant Sibal. Thanks for joining us, Siddhant. Now, India has kick-started the second phase of the vaccination drive, a highly ambitious one at that, with the Prime Minister, of course, taking the indigenously developed vaccine. Tell us more about the second phase and, of course, the challenges ahead.
Well, the second phase has in fact started. It was expected to start at 9 a.m. Indian Standard Time, and of course we are past that time. But we know that the day started with perhaps one of the biggest stories on the vaccination drive. The Indian Prime Minister getting vaccinated. A message of confidence for not only people here in India but for entire world. We know that India is leading from the front when it comes to delivering vaccines to the neighborhood and across the world. In fact, barring Pakistan, all the countries in the region have been given India-made vaccines, and we know that they have begun their vaccination. In fact, Afghanistan, Maldives, Sri Lanka, Nepal and Bangladesh began their vaccination drive using India-made vaccine. In fact, India makes 60% of the global vaccines and is being termed as the pharmacy of the world amidst the COVID pandemic. How India reached out to the world community, giving out medicines to them, paracetamols, and now, of course, the vaccine. But the Indian Prime Minister now joins the league of US President Joe Biden, Israel's Prime Minister, the British Queen Elizabeth, and other leaders, in fact, Indonesian President as well, in terms of getting vaccinated. And we also know that before the Indian Prime Minister got vaccinated, leaders like the Mongolian Prime Minister and the Maldivian President have been vaccinated using India-made vaccines. So a major confidence building measure for the India-made vaccine. We know that India has been using this as a major diplomatic tool. This is something that has been lauded across the world. In fact, just a few days ago, the Afghan president publicly lauded the role India is playing in terms of capacity building and giving vaccines. India's vaccine is being used to vaccinate the Afghan national security personnel and, of course, the healthcare workers there. So, largely a very, very positive development.
Now, Siddhant, it is also important to note, as you just mentioned, that unlike other countries where political figures and heads of government were given priority, the Indian Prime Minister has waited till the second phase got underway. So tell us more about the same.
Well, we know that he has been having a number of virtual meetings with the chief ministers of various states. And in fact, in one of the meetings, he said that we will not get the vaccine first. The public representatives will not get the vaccine first. It will be the healthcare workers and the frontline workers who will be getting vaccines first. We know that India started its mega vaccination program in the month of January, and since then it has vaccinated crores of healthcare workers and, of course, frontline workers. Now, of course, as you pointed out, that now the focus will be on people 60 plus and people from 45 to 50 who have other diseases as well. So that is the focus in a second vaccination drive which India is starting, India has started today. And in fact, we know that as you pointed out, the focus will be on making sure that more and more people get vaccinated. That, of course, is India's top priority. And what makes India's vaccination drive different from the other vaccination drive is the scale of it. India is a huge country, and vaccinating people here is, of course, always a difficult task. And we know that there are, of course, apprehensions as well, especially in rural areas. So with the Indian Prime Minister getting vaccinated, this is a major confidence building measure.
Right. My final question, Siddhant. We are also seeing a surge in cases in certain states in India, and the Prime Minister, of course, has been urging one and all not to let their guards down. And now with the second phase of the vaccination drive underway, is there fresh hope of finally beating this pandemic?
Well, obviously, there is always focus on trying to make sure that this COVID pandemic can be controlled. But as you have just mentioned, that there are significant surge in case number as well in states like Kerala, in Maharashtra. And for that, there was a high-level meeting as well last week. The meeting also focused on the measures which can be taken. In fact, there are states who are mulling on the lockdown as well. But largely, the fact that the vaccine is available, in fact, in private hospitals as well, is something that will help people to get vaccinated and fight this scourge, which of course has changed the world outlook in every sector, from diplomacy to how people work. We know that how it has impacted, it has dramatically changed how people used to work previously before the COVID pandemic had struck. But largely how India tackled the crisis, how India was able to be a country which starts exporting masks and medical equipment as compared to before the entire crisis impacted the world. And of course, India is something that has been lauded by world community. In fact, we know that the World Health Organization chief recently tweeted lauding India's capacity and how India is reaching out to the world. We know that there is obviously a concern about vaccine nationalism across the world, and how India is taking measures at a time when there has been surge in cases is something that is noteworthy, not only here in India but across the world.
Right, Siddhant, thank you so much for all your inputs, and thank you for joining us on this broadcast. WION World is now available in your country. Download the app now and get all the news updates on the move.